Thank you, Jalen, for the warm introduction, to Will, to the rest of the team for having me today. Thank you for all being here. We're excited to host you at TMC Innovation. I'm going to just tell you a little bit more about this whole space. We're going to get to go on a tour and see some more of it as we go forward. But this is really more about creating community, and what that means for us is having an invitation for more people to be invited to participate in healthcare innovation. And so that's mostly what I want to talk about today. So as we heard already, I didn't really have an entrepreneurial path. I didn't think that I was going to be in innovation. This was all sort of something that I feel like I fell into. So I think that's one of the first things that I talk about when I talk about career paths, or what is innovation. It's not a Silicon Valley guy in a hoodie. It's about whatever you make it. And there's a way for everybody to contribute to innovation in the life sciences. It seems like you have to have an MD or a PhD to do it. That's also completely not true. My PhD unlocks a lot of doors for me, but I don't think that it's necessary for everybody to do. A PhD is also not something that I had on my radar when I was in high school. So it's something that is all about being creative and solving problems, and it's a lot of art and troubleshooting involved. So even though it sounds like something really crazy that I did for my PhD, it's also something that anyone in this room can do for sure. So I would love to continue that conversation around how to get into science and engineering and innovation anytime. But today we're also here to talk about the community that we create here at TMC Innovation. We have 300 startups that have come through these doors. They're doing everything from sort of helping hospitals to better manage their processes, to creating 3D printed organs that will one day be able to enter our bodies. And so there's a lot of different things that encompass healthcare innovation, and we're here to support all of the different innovators as well as the people in the hospitals to help them get connected to each other. So it takes a lot of different people to do this with a lot of different types of skill sets. We have scientists and engineers that make some of the products. We also have folks that are in the hospitals kind of managing how healthcare happens every day. We have individual clinicians. We have folks that are doing the pitch decks and designing those. And we have those that are doing the business development and talking to a lot of people about how this gets done. So there's a lot of ways to participate in healthcare innovation, and a lot of different people that I work with every day. So here at TMC Innovation, we're also a place where startups come, and so they will sit in the offices that you may have seen when you go to the bathroom in the back, and we'll talk about that when we go on the tour. And it's also the people that are supporting the startups. So people from big companies, people from small consulting firms also come in here to help startups. At the end of the day, we're all unified by the vision that we're going to make healthcare better. And so that's what we all get excited about, and that's something that really unifies all of us. So for me, getting to work with people that are trying to make an impact on the way that we see our health and our well-being and are doing things to take the step forward is really inspiring. So that's pretty much it for kind of like how I got here. A little bit more about the place that you're in right now. This actually used to be an old Nabisco cookie factory. So they made Oreos here, they made saltine crackers and Lorna Doones, which are little shortbread cookies. So this place used to smell like cookies all the time up until about 2000. You could smell it apparently even driving past without even coming into the place. So it was taken over by the Texas Medical Center, which is also a nonprofit organization that is supposed to drive collaboration between all the hospitals that are just down the street. So if you think about MD Anderson or Baylor College of Medicine or Rice University or University of Houston or UT Health, all of these different organizations are also nonprofit, and they kind of compete against each other. And so the Texas Medical Center is here to drive collaborations between them and to try and say, we can work better together. Let's figure out a way to do that. And this place is one of the ways that we try and do that through innovation. innovation brings people together. People are excited about it. People want to see the future and create the future, and so they want to opt into what we're doing. And so it's a way that we can get people from Baylor and MD Anderson and Houston Methodist at the same table and say, hey, let's collaborate on something. Right now, one of our big projects is clinical trials. So before any product goes into use in a human, it is tested through clinical trials, usually drugs, but also devices. And so one of the big projects that we're working on with them is to try and help them share different patient information so that more patients can have access to these cutting edge drugs and therapeutics, for example. So this space is also where that company first found out about us and we found out about them. So it's a California-based company, but they came through all the space that you'll see in a minute, and we got to meet them, we got to know them, we got to figure out what they were doing and find out that they're really bringing together these healthcare organizations, and that we as the Texas Medical Center can help to unite all of the different hospitals through working collaboratively with this startup to help bring more clinical trials to Houston and to bring more patients access to these technologies at the early stage. So that's just one example of one company that we've worked with. We also start companies from scratch here, so different individuals who maybe were a clinician or an engineer or working in the business side of things come together, we form a team, and they develop a technology. We patent it, we send them on their way, we try and support them through our other programs. So we have a JLab for wet lab space next door so they can do their prototyping and develop. Then they come through our accelerator, which helps them more with the business side and the connections. And then they can have office space with us and just come here to work every day and be rubbing elbows with the other innovators and just get some mostly emotional support. It's very difficult to be an entrepreneur. It's a very hard road. You have to make all the decisions on your own, and you try and get advice from as many people as possible, but it's sometimes just down to you at the end of the day, and that can be very challenging. So part of the benefit is just to be next to people that are in the same journey as you are. So like I said, we do a lot of different things. We have two main pathways. It's technology in and technology out. So the clinical trials tool that I was talking about is an external technology that comes and is deployed at our hospitals here. But then we also, like I said, start new companies from scratch or help the people that are in the hospitals to develop their own technologies. So all that to say, there's a lot going on here. There's a lot of opportunities to get involved. And there's a lot of opportunity for you to be in the entrepreneurial journey. You don't have to start your own company. I didn't start my own company, but I'm here. I'm involved with a lot of different startups. You can be a graphic designer. You can be on a sales team. You can be the entrepreneur yourself that has the idea and takes it forward. So there's a lot of ways to get involved. There's a lot of things to do. In healthcare, it is more difficult for high school students to get involved because a lot of the hospitals require folks to be 18 and up. So just keep it in mind right now that you're getting there, you're going to go forward, but there are lots of things to jump into when you're ready. And I'm always available to help guide you to what might be possible even right now. So that being said, we can just all get up and take a little tour of the space. So I'm going to meet you outside in the main space to the left.
All right. Excellent.